we're going to talk about assessing the therapy horse. As we have talked about throughout this course, there's no one correct way of offering equine-assisted activities and therapies. You have OK Corral, EAAT, RDA, Path International, Adventures in Awareness. All of them have different philosophies of how they use the horse, and this is something that you need to take into consideration in your programs for what you need out of your horse. So let's take a quick look. First of all, for all of these, you need to find the method that most suits your style. Try them all on for size. Some of them are going to feel very comfortable, some of them are not. It really depends on where you are in your comfort level with risk. What do you need in place safety-wise for you to feel more effective in your sessions? How do they use the horse? How do they think of the horse? What is your role? Are you an equal partner with the other parties? So with all of this, find the method that most suits your style. So let's talk a little bit about the views on the horses. So EAAT feels that the horse is a sentient being. It is an equal part of the team. It should not be instrumentalized, which means it should not be a tool. The horse is the lead. The horse is going to show you, for EAAT, the philosophy is the horse is going to show you what is needed in the session. The horse is never ridden. It is groundwork only for EAAT. The horse is never forced to work. The horse is not a tool, but is equal to the human. So in an EAAT session, the horse, the ES, and the mental health professional are all equals. For training, EAAT does not do any special training of their horses beforehand. They do an assessment to make sure that they are proper, but they do not have training rules. Path International feels that the horse is a sentient being, which means it is a thinking, feeling being. It is to be respected and cared for as a valuable member of the team. It monitors and limits max workload for horses. So with Path International, a horse cannot be used for more than 6 hours a day, no more than 3 hours at a time without a lengthy break. A lengthy break means that they are untacked and have access to food and water. They do both ground and mounted work, and there are few rules on how to do the training, just that it must be done and it must be documented. Horseboy is used for body work. They do a lot of riding double. It is for neurodevelopment, sensory connections. They do trick training. One of the interesting things is the horse comes to the rider rather than the rider going to the mounting block with the horse. The rider is in charge of the horse. And this was designed specifically for children with pervasive developmental disorder. Natural lifemanship is a EAP, a trauma-focused equine-assisted psychotherapy program for the most part. It is about safe relationships. It's not about boundaries, but developing safe relationships. One of the things that they teach is that a relationship has to be beneficial to both sides. It needs to be beneficial for the horse and beneficial for the person. And that is also what it is in life, that in a relationship with two humans, the relationship should be beneficial to both sides. They don't use metaphors. They do ground and mounted work. Their mounted work is called rhythmic riding. And as I said, it's trauma-focused EAP. Epona Quest believes that it's the horse's choice to work with the client. They pick their client. So the horses may be out to pasture and the client will walk up to the fence line and the horses will come up and choose their client. There's other ways of doing it, but that's just one example. The horse is considered a co-facilitator. The horse is to be treated with dignity. One of the things that they stress is that they need to match the activity to the physical agility of the horse and the client. All of the programs believe this, but this is the one that says it very, very strictly and directly. And they do ground and mounted work. So assessing horses. Without the horse, we don't have programs. But not all horses are appropriate for equine-assisted activities and therapies. At the last stats that I saw, for every 17 horses that were brought in to a center, one stayed. One of the reasons for that, there are many different reasons, but one of the reasons that we're finding is that horses don't understand make-believe. And EAL and EAP, the activities and exercises out there are make-believe in some ways. If you want to, it's untraining of the horse, and some horses can't recover from that. They can't come back really quickly to their normal state. What we always try to do is after an activity or exercise in the arena, when the horse is done, then we will have the horse, we will bring the horse back to doing something that is in its routine. We'll either ride it in a pattern, we'll take it for a walk, something to that extent. So finding the therapy horse, the first thing you need to do is, what do we need? Are we looking for a therapeutic riding horse? Are we looking for an EAL or EAP groundwork horse? What do we need at this moment? So if we have a veterans program and we're probably going to have riders that are around 200 pounds, it could be up to 200 pounds or more, what kind of horse are we going to want? We're going to want a draft or a large quarter horse, well-trained, tolerant, that can walk, trot, canter. If we need a children's horse, that we're having an at-risk program that we have a wait list for, and it's for the ages of 7 to 11, what type of horse would we need there if it was a therapeutic riding one? We could use a smaller quarter horse, an Arab, POA, Haflinger, things like that. So things to consider of what do we need. What we don't want to do is take any horse and make the horse work for the program. What we want to do is look at the program and what do we need for it. Do we need a mini in order to go into the schools? So we need to fill our needs. So the first thing that usually comes up is soundness. Does a horse need to be perfectly sound? For a therapeutic riding program, the horse does not need to be perfectly sound, but it does need to be symmetrical. And what I mean by that is that when it moves, the hip should be moving symmetrically. It should be having that movement go to the rider in a symmetrical way so that there isn't one side that is dominant. When you look at this picture, would you think that this horse is going to move symmetrically? As you can see, the right hip is lower than the left, even at standing. So most likely that horse is going to have a left-sided dominance, which transmits to the rider and can target things that we're not looking for. Other factors to consider is if the horse has a lameness issue, a small lameness issue, that we can make them more comfortable. What is the cost of that? What is the upkeep of that? How old are they? How long do we think we can maintain them in the program? Horses with lameness, even with an EAL or EAP program, we can use some, if it is minor lameness and doesn't show itself quite a bit when they're walking and moving, we can use a horse like that. But for the most part, for lameness, it's best not to use a horse in an EAAT program because it can be sending a mixed message to our participants. So your first contact with the donor is going to be an interview on the phone. Usually you're going to get a call that someone wants to donate their horse, or they have a horse for sale that they thought you might be interested in. You can download the form that is in your files. I think it's in this week's module as well. And so some of the things you're going to talk to them about is the big ones. Does the horse have a history of buck, bite, bolt, kick? Those are your no-goes. If a horse has a history of those, then you don't bring them into the program. If they do not have a history, you can continue on the interview. Find out about any lameness issues they've had, how they get along with other horses. Are they stall kept? Are they pasture kept? Are they ridden English or Western, or are they ridden at all? Do they know natural horsemanship? What do they spook at? I think one of my favorites was the answer to that was one man said that, oh, he doesn't spook at anything. No, I take that back. He said bear. He doesn't like bear. When the bears came in his pasture, he spooked a bit. I'm thinking, okay, I want that horse. So ask the questions. From there, you're going to have an idea of whether this horse may be good for the program. If the horse is not, make sure when you say no, that you say no in a way that says it's us, not you. It's not the horse, it's us. Because you never know when this donor may have another horse that would be perfect, or they may donate to the program at a later time. So if the horse isn't correct for our program right now, you can say something to the extent of, he sounds really great, but right now what we need is a horse that's around 15 hands for some very specific riders, but we really appreciate the call. And if you'd like, we can put the word out too that you are looking for a home for this horse. So it's always about us, and you always make sure that you leave it in a positive way. So they pass the phone interview. So the next stage is the initial evaluation. The initial evaluation is done on-site, either on-site at where the horse is kept or on-site at our facility. The team goes. It's at least 2 people from the EAAT team. And this is how it works. You will show up, and then you will observe the owner with the horse. If you get there and the horse is all sweaty from being worked, reschedule. You want to see the horse pretty much cold and see how they respond. So first thing you're going to do is you're going to observe the owner with the horse. How does the horse lead? How was he when he was being groomed, tacked? And then you're going to watch the owner ride. How does the horse respond to different cues? How does the horse respond to the extra stress of the environment of being watched for and assessed? And then if it passes the owner riding, then one of the EAAT team members will ride. Walk, trot, canter, if applicable. And then if they pass that, they're going to do a test tolerance of basic toys. Your basic toys are going to be bubbles, balls, rings. How do they do with these new types of toys? Squeaky toys. One of the funny ones is a lot of the horses don't like the little plastic dinosaurs. So we put those in there and just see how they do. Now, they don't have to pass that with flying colors, but what they do need to do is have a spook where it's in place. And they have to appear trainable for this. If they pass that, you ask if they can come in for a 90-day trial period. We have a contract for that, and we'll go through that later on when we talk about business. But the trial period starts from the moment they get off that trailer. You're going to see how they come off that trailer. How long does it take them to get settled in? What are their stall manners, their temperament, their friendliness? How are they when they're being groomed? Are you finding any unsoundness or blemishes? Do some natural horsemanship. Are they understanding what we are asking? Are they resistant? Are they not sure? Do they give to pressure? Do they lead with body language? Then you're going to go into riding. What is their temperament? What is their reaction to the rider, the level of training? Do they get frustrated easily? This is a new environment, and this is testing that as well. Lunging and round pen, manners, soundness, stamina. Are they getting tired out in just a few laps? And then you're going to start toy work and find their spook spots. Every horse has one. We're going to find it and make sure that we can work within that. And what they do when they spook. Do they bolt? Do they stand in place? Do they turn to what is spooking them? And then we're going to do bareback pad work. And with that, you're going to look and see how they do with their reaction to unbalanced riders. Toys on their back. Are they comfortable with being ridden bareback? And are they comfortable to ride bareback? As you go on for the first 60 to 90 days, you're going to do exercise riding. Slow is okay. And I would actually say, I'm going to go back to this would be the first 90 days period. I would start from day 1. As soon as they're ready to be ridden, I would start exercise riding. Slow is okay. Over ground pulls. You want to build up that back. You're going to focus on relaxation, tune up or desensitize to the aids. And experience your spook spots and start working on those. You're going to do groundwork, walk, trot in hand, tune up manners, start work on ramps and stairs, introducing them to the ramp, introducing them to the stairs, introducing them to toys, the balls, the bubbles, the pool noodles, the toy dinosaurs, the rings around their ears, and lunge and round pen work, and exposed to multiple volunteers. In many of these centers, some of the larger centers, a horse may be exposed to up to 100 volunteers a week. You need to be sure that the horse can tolerate this round robin of volunteers that may come through. One thing to note when you're talking about introducing toys is a horse should never be tied when you are introducing something new. It should always be held by another team member when you are introducing something. That way they are able to move away from it. Then you start the pad and saddle work with a mock rider. You're going to start with a mock rider with a horse leader, and then you're going to add a horse leader and a sidewalker, and then a horse leader and 2 sidewalkers. How do they do with an unbalanced rider? How do they do with the games that we play? How do they do with the horse leader directing the horse and the rider trying to direct the horse? Do they get frustrated? Who do they listen to? And how do they do with confusing cues from the rider? All that's done. And now we say, okay, what type of rider is this horse suitable for? Are they confident with difficult mounts? Difficult mounts can be your full lift wheelchair mount from the ramp, where you have 4 or 5 people helping. It's pretty claustrophobic. Are they confident with those type of mounts? Are they patient? Are they smooth? Are they dead-sided, or are they more sensitive? Which type of rider would you put with those type of things? If you have a horse that is dead-sided, it may be perfect for your rider that has spastic cerebral palsy. If you have a horse that is more sensitive, that spasticity and tightness with the legs may not be appropriate. And then how do they handle the unbalanced riders? Do they stop when someone gets unbalanced? Do they try to get under the horse, under the rider? How do they react? The next thing you're going to look at is movement. When a horse walks, it transmits about 110 three-dimensional movements impulses per minute onto its rider. The movements are along an anterior, posterior, back and forth, lateral, and rotational planes. The rider's pelvic movement is the same as the pelvic movement of a normal person walking on level ground. This is where your symmetry is so important. When that movement is transmitted to the rider, it needs to be symmetrical and even. Now, a horse will have a dominant movement. They maybe have more movement anterior or posterior than they do laterally or rotationally. This is great. Next week we will go into how to assess all of that and use it for therapeutic benefit in your classes. So all of this, you need to consider legal considerations. Document, document, document. There are forms that you can download from your files where you will document all of the training, all of the notes, because if anything were to happen in the future, you would want to be sure to be able to show that this horse was the correct horse for that rider at that time.